Good afternoon and welcome back to Downing Street for the daily coronavirus briefing. I'm joined by the Chief Nursing Officer Ruth May and the Deputy Chief Medical Officer Jonathan Van-Tam. Our plan is to protect life and to protect the NHS, both by slowing the spread of this virus to flatten the curve and by ensuring that the NHS always has more capacity to provide the critical care for those in need. Now, this is a national effort, and every single person in this country can play their part in this plan. This Easter will be another test of the nation's resolve. It's a time of year when people normally come together, but however warm the weather, however tempting your local beach or park, we need everyone to stay at home. Because in hospitals across the country, NHS staff are battling day and night to keep desperately sick people breathing. And they need you to stay at home. I'm very happy to report that the Prime Minister's condition continues to improve. He wants to personally thank the whole clinical team at St Thomas's for the incredible care that he's received. His thoughts are with all of those who've been affected by this terrible disease. The NHS is there for all of us in this country, and I know our amazing NHS staff have given the Prime Minister the very best care possible. In the same way that they would give every single person in this country the very best care possible. One of the things that makes me proud of this country is that it doesn't matter who you are, the NHS is always there to care for you. Before updating you on our plan, I want to share the latest data from the ongoing monitoring and testing programme. Yesterday, I'm glad to report that 19,116 tests were carried out across Great Britain. 5,706 tested positive. The number of people currently in hospital with coronavirus symptoms is 19,304. Of those who've contracted the virus, 8,958 have sadly died, an increase of 980 since yesterday. We never forget that behind this number, behind each one is a name, a loss, and a family that'll never be the same again. And we all share a responsibility to tackle this virus, first and foremost, by staying at home. Now, earlier this month, I outlined our 5-pillar testing strategy, and I'm glad to report a very positive response to setting out the goal of 100,000 tests a day by the end of the month. I can announce today that we have capacity for all key social care staff and NHS staff who need to be tested to get those tests. To deliver this, in addition to the testing being done in NHS hospitals, we've now opened 15 drive-through testing centres, including in Glasgow, Cardiff, Belfast, Nottingham, Plymouth, Leeds and London and other places. The UK life sciences industry is also answering our call to arms. Yesterday I opened our first of our 3 Lighthouse mega labs in Milton Keynes. 2 more are on track in Cheshire and in Glasgow, and AstraZeneca and GSK, 2 of the biggest pharmaceutical companies in the world, are opening another in Cambridge. And I want to thank the team and all the volunteers who are working night and day to make this happen. Today, I want to address what we're doing to make sure that we have enough PPE, protective equipment, and to make sure that it gets to the right people. The goal I've set is that everyone working in a critical role must get the PPE that they need. NHS and care staff protect us every day. While we're safe at home, they go off to work to care for us. We owe it to them to get them the kit they need to protect themselves. I want to be frank about the challenges our plan is designed to overcome. First, there is a huge international demand for PPE and a global squeeze on supply. Compounding this, some countries have placed export bans and other restrictions on PPE as they look to secure their domestic needs. Next, there's high demand for PPE from within the UK. So everyone should use this equipment, use the equipment they clinically need, in line with the guidelines, no more and no less. Then, of course, there's the challenge of distribution. The sheer quantity and type of PPE needed has radically changed because of coronavirus. Many parts of the NHS and social care have never had to rely on weekly PPE deliveries before. In normal times, the NHS supply chain for protective equipment supplies 233 hospital trusts. Right now, 58,000 separate health and care providers need PPE. So we've had to create a whole new logistics network, essentially from scratch. All of these challenges around supply, around usage and distribution are being overcome. And I want to take a moment to set out in detail how. Today we're publishing our PPE plan. It has 3 strands. Strand 1 is about guidance, being clear who needs PPE, when they need it, and who does not. There's enough PPE to go round, but only if it's used in line with our guidance. We need everyone to treat PPE like the precious resource that it is. That means only using it when there's a clinical need and not using more than is needed. Last week, following extensive consultation with the medical Royal Colleges, all 4 UK governments published updated guidance for what PPE to use in what circumstances. The new guidance included the clinical advice that many items of PPE can be used for a whole session, not be changed after treating each individual patient. Everyone is still protected, but there's enough PPE to go round. The guidance is also clear where PPE is not needed. Because outside of health and social care, in most circumstances, the best way to protect yourself and to protect others is to regularly wash your hands and wherever possible to keep at least 2 meters between you and other people when you leave your house. And of course, the most important way to protect yourself is to stay at home, because a front door is better than any face mask. The second strand of our PPE plan is about distribution, making sure that anyone who needs PPE can get it and at the right time. This is a Herculean logistical effort. We've brought together the NHS, private industry and the army, in fact the armed forces, to create a giant PPE distribution network on an unprecedented scale. That network is now delivering daily to our frontline heroes, quite literally. Since the start of the outbreak, we've now delivered over 742 million pieces of PPE to the front line. This includes 161 million masks, 127 million aprons, 1 million gowns, and 345 million pairs of gloves. These have reached hospitals, ambulance trusts, GP settings, social care, hospices, and community pharmacies. We've also set up a 24/7 hotline for any providers experiencing supply problems. And crucially, every NHS hospital has received a delivery of critical PPE once every 72 hours, and over the next week we're making that daily. This week we've arranged a priority drop of 30 million items of PPE to the local resilience forums. The LRFs are in turn delivering to social care and others according to local need. And in the coming weeks, we'll be scaling up our PPE delivery systems still further. I can announce that over the next 3 weeks, we're rolling out an online portal allowing primary care and social care a system so that they can request PPE from a central inventory. And this will mean that we can track demand in real time and deliver according to need. This Herculean effort of enormous operational complexity to get the right piece of equipment to the right person at the right moment, I pay tribute to the enormous efforts of all those who are making it happen. We will do everything we possibly can to keep improving this, but I want to take a moment also to say thank you to all those involved. The third strand is about the future supply, which is making sure that we've got enough PPE to see us through the crisis. We're using up PPE on an unprecedented scale, so we're constantly buying more from abroad and now making it at home. Our PPE sourcing unit is securing new supply lines from across the world, ensuring that what we buy meets rigorous standards. And this includes teams from the Foreign Office, the Department for International Trade, out in the Far East especially, buying directly from manufacturers, and teams in Whitehall focused on rapid freight operations to get it here. We've published the standards that we'll buy against, along with our global shopping list. And it's also about ramping up domestic production as well. Going into the crisis, we did not have a major domestic PPE manufacturing industry. So, like with ventilators and with testing, we're creating one. Many businesses have generously come forward with offers to turn over their production lines as part of this national effort. In particular, I want to thank Burberry with their offers of gowns, Rolls-Royce and McLaren, who are creating visors, Ineos and Diageo, who are producing hand sanitizer. We're talking to many others, and we want more to step up to the plate. So if you've got production facilities and you can meet our published technical specifications, we want to hear from you so that we can make this kit here in Britain that'll keep people safe. This is our comprehensive PPE plan to protect the people who protect us, to make sure they have the kit they need to do their job safely and with confidence. But I want to finish by saying this. Even if you're not directly involved in the NHS, in the PPE supply chain, in testing, or as a key worker, there is something that every one of us can do to play your part in the national effort. Stay at home, because spreading the virus today risks lives tomorrow, and it increases pressure on those who work in the NHS. Do it for them. Do it for the people who you love. The more we all follow the rules, the faster we can lift these restrictions and get back towards normal life. Thank you to all those of you who are already doing your bit as part of our national effort. Stay well, stay at home, protect the NHS, and save lives. I'm now going to hand over to Chief Nursing Officer Ruth May.
Thank you very much, Secretary of State. First, I'd like to offer my personal wishes to the Prime Minister in his speedy recovery. But this bank holiday is like no other that I can remember. At Easter, we're normally looking forward to catching up with friends, seeing our families from across our country. But at the moment, we're asking you to stay home. It's not possible to do that this year, and I know that is difficult. Staying at home is saving lives. The actions that you take this weekend will have consequences. By staying at home, you will help us. I want you to remember the sacrifices that others are making. The nurses, the doctors, the physios, the HCAs, the countless many others are not at home this weekend because they're working in our hospital, in a social care setting, saving patients' lives. I want to offer my sincere thanks to each and every one of our NHS and social care staff for what you are doing round the clock. And I also want to offer my thanks on behalf of the NHS staff to all of those key workers who have allowed us to keep working. Teachers, childcare, supermarket workers and others. You are helping me stay at work and others stay at work like me. You may have seen some TV coverage this week about what's happening in our hospitals. Dedicated, skilled, professional NHS staff calmly dealing with the mounting numbers of patients with coronavirus. They are frank about the toll it takes, both physical and emotional. And of course, nurses, healthcare assistants, midwives and other NHS staff are now among the victims of this coronavirus. Some have lost their lives. The loss of our own, however they have contracted the virus, is heartbreaking. The NHS is a family and we feel their loss deeply. I'd like to offer my sincere condolences to the family, the friends and the colleagues of every member of NHS staff who have died in the recent weeks. Every single person in this country can help our nurses and our NHS staff. You can keep yourselves and others safe and out of our hospitals by staying home. We freed up more than 30,000 beds, the equivalent of 50 district general hospitals in the past few weeks, and that's before opening the extraordinary NHS Nightingale Hospital in East London. And I'm pleased to announce today that alongside the new hospitals in Birmingham, Manchester, Harrogate and Bristol, I can confirm that Sunderland and Exeter will soon see Nightingale hospitals in their communities too. These extra hospitals, if we need them, will be part of the NHS's nationwide response to coronavirus, the greatest healthcare challenge the NHS has ever faced. And I'm proud that continuing a tradition dating back to the founding of our NHS 72 years ago, nurses are at the heartbeat of this People's Health Service. These are difficult days, but amid this dark news that each day brings, my colleagues are sustained by the extraordinary shows of support for the NHS that has been received from our public. The rainbows, the NHS signs in the window lift me and they lift my colleagues. I'd never thought to see people across this country clapping and showing your thanks every Thursday. It means a great deal to me and my colleagues, more than I can say. But there is one thing. There is no doubt that the single greatest thing you can do to say thank you to our NHS and social care staff is for people to follow the advice. This is a long weekend. We need you to stay at home and stay safe. Thank you.
I'll now ask Professor Van-Tam to take us through the slides and the data that we publish every day.
Thank you, Secretary of State. May I have the next slide, please? Okay, so you'll recall that 1 week ago I presented some data to you on transport use and how that had changed over time as the public had followed our social distancing advice. And I'm pleased to report to you today, you can see on the slide, that in the week that has passed since I last stood at this podium, the trend has continued that use of various forms of public transport have all stayed at low levels. I can't tell you how important it is that you just keep going with this. This is not over. When I move on to the next slide, you'll see it's not over. We have to keep pushing as a nation to maintain our social distancing. We have to take the pain now to make the gain in a few weeks' time. Next slide, please. So this is a slide which shows you from the 16th of March on the left through to the 10th of April on the right, new UK cases. And these are based on the day on which the laboratory test was completed. So, of course, there is a little variation there between when the test was taken and the test was completed. But nevertheless, you can easily see the broad trend that we have been in an increase phase, and now we are at a point where we're at a high level and the numbers are varying day by day, but they're at this high level. We are in a dangerous phase still, and I need to reinforce that again to you, that this is not over. Next slide, please. If you look at people diagnosed with COVID-19 who are now occupying hospital beds in Great Britain, you can see that again over the period of the slide from 20th of March through to the 9th of April, there has been a steady increase, but possibly you can see that the curve is bending. It's impossible to say that we have peaked. London has gone down in the last day, but the North East and Yorkshire have gone up. However, I suggest to you that the curve is beginning to bend and that your hard work is beginning to pay off. But again, I say, this is just not over. It needs to continue. Next slide, please. If you look at critical care, the slide talks for itself of the extent to which London has been the epicentre of our first wave, and you can see that the other parts of Britain are at a lower level. But the trend overall is pretty much the same, that there has been this sharp increase. There may be some signs that the curve is beginning to bend, but it's premature, absolutely, to say that we're at a peak, and the push that we're making with social distancing just has to continue. I would add a personal touch here and say that my mother-in-law is a healthcare assistant. Two of my best friends, one is a nurse, another one is an operating department professional who's been repurposed to high dependency to work on this crisis. This really matters, and it really matters that we keep going with it. Next slide, please. If you look at the global death comparison on this slide, again, as last week, these are synchronised so that day 0 is the day at which each country reported 50 deaths. And you can see that, again, there is this broad, similar trajectory across many countries that report data, with 1 or 2 outliers. And the UK continues to be broadly in line with what is happening in other countries. It's still a dangerous situation. We have to keep taking measures to bring this under control. Thank you, Secretary of State.
Thank you very much. So if we now go to questions, the first question we've got is from Hugh Pym at the BBC.
Thank you very much. Secretary of State, you and other ministers have said repeatedly in recent weeks that you have plans to get protective equipment to the NHS and social care. Health and care workers are saying to us they are still struggling in some cases to get that equipment. They feel unsafe. Aren't you now acknowledging that previous plans were just not enough, were not sufficient?
Thanks. What I'm acknowledging is that this is an enormous challenge, a Herculean, a logistical effort. We've so far delivered 742 million pieces of protective equipment, but it is a task that needs a constant effort because of the 1.4 million people who work in the NHS and the over 2 million people who work in social care, using PPE has gone from being something that happens in a relatively small way to right across the board. And the critical thing is that people use PPE like the precious resource that it is, and that we get the PPE to them so that they can always have what is clinically needed. Now, of course, I listen to the concerns that are raised with me, and what I can tell you is that the team who are trying to deliver on this have themselves put in an enormous effort. We are getting the PPE out there, but there's clearly a huge task ahead to keep it flowing and to make sure that those who need it get it. I don't know if Ruth wants to say anything in terms of a report from the front line as a nurse yourself.
Absolutely. So I know as a nurse that PPE is very important for their safety, but also the feeling of being safe. I know that I also want to make sure that people are using it and are wearing it to the right level and the right environment, and that's really important. But I also know and I hear that it's a challenge, it's a struggle right now to making sure we've got it everywhere we need it at the right time. And that is what the Secretary of State has already set out in his strategy being launched today, about making sure that the government is doing just that, and collectively we're wanting to do it. But it's really important we're doing that. I know also I was yesterday at the London St Nightingale Hospital receiving my refresher training about how to put my PPE on and off. And it's a challenge. It's tough wearing PPE, so I want to also recognise that for all of our staff right now.
Thanks very much. Sejal Maria from ITV.
Can I come back?
Sure, yes, Hugh. Sorry, we'll go back to Hugh and come back to you, Sejal.
Yeah, just very quickly. I mean, you've published plans before and given reassurances about protective equipment. There will be a lot of scepticism, won't there, still, about another plan being published. I mean, what guarantees can you give that people will be made to feel safe with the right equipment?
Yes, well, we have made progress on PPE throughout this. I think what you might be referring to in terms of what we published before was last week, making sure that we brought clarity to what PPE is needed in what settings. This plan is about that, but it's also about how we then deliver with details of how the supply chain works, and also, crucially, how British manufacturers can step forward and deliver to specifications that we've published the technical details of, so that manufacturers can come forward to replenish the stocks that we've got. What I'd say is that it is a constant effort to get the PPE to the front line, a huge logistical effort. We acknowledge the challenges, of course we do, we face them every day, and we are doing everything in our power to get that PPE to the front line. And those with concerns about PPE at the front line, we're making sure that they have a place that they can go in order to call for help. So it's a detailed plan set out in public, both so that we can encourage more suppliers to come and replenish the stockpile, but also so that everybody can see the challenges that there are and how we're proposing to overcome them. If we go to Sejal Maria now at ITV.
Thank you, Secretary of State. It's good news that the Prime Minister's health is improving. Does he accept, though, that he is unlikely to be able to return to work soon? And is the government ready to take key decisions, such as whether the lockdown will be extended in his absence? And given the Republic of Ireland just announced their lockdown will continue until the 5th of May, shouldn't you level with everyone that we are heading for a much longer than a 3-week lockdown too?
Well, the Prime Minister is recovering, and I'm sure the whole nation is delighted to see the news that he's getting better. And the fact that he was so ill demonstrates once again just how serious this disease is. And I'm delighted about that. The good news is that the government in his absence has been functioning very efficiently, very effectively. The Foreign Secretary yesterday made clear that we don't have enough information yet to be able to make any changes to the social distancing arrangements, and that SAGE will meet next week and they will look at the data then. The way that we make that decision has been set out very clearly and is functioning very well. I think the Foreign Secretary is doing an excellent job in chairing the committee that makes these decisions in the Prime Minister's absence. But that is within the context of a strategy that the Prime Minister very clearly set out, and that we're working through, and we're able to get on with the day-to-day things, like publishing today's PPE plan, and do the things that are needed whilst the Prime Minister recovers. Thanks very much. Ben Kentish from LBC.
Thank you, Health Secretary. Many people around the country, many LBC listeners are asking why the UK is continuing to allow people to enter the country from virus hotspots and planes to land without the people on those planes even being tested or asked to quarantine. Isn't there a real risk that once we do pass the peak, all the efforts that we've made to reduce the number of cases risk being undermined by people continuing to enter the country unchecked from other countries where the number of cases is still much higher? And what measures will you put in place to stop that? And if I could just ask Professor Van-Tam, Health Secretary said there that staying behind your front door is better than any face mask, but other countries are not seeing it, of course, as an either or. Germany this week becoming the latest to say that face masks would be a key part of their exit strategy, a key part of their plan to tackle this virus. the UK risks becoming a bit of an outlier here because the government's position is that there's no real benefit to those masks. Can I just ask what evidence our decision has been based on and why you think other countries have taken such a different approach if the science does say that masks aren't particularly effective? Thank you.
Well, the answer to both questions, Ben, is the same, which is that we follow the science. And we've followed the science in terms of international travel all along. And we saw right at the start of this pandemic that the two countries that brought in the most draconian international travel restrictions, the United States and Italy, both of them have now got serious problems themselves. So I think that the science which said that, which we followed on international travel, has been borne out by events. On the second question as well, I'll hand over to Professor Van-Tam, but I just want to absolutely underline the same point, which is that we follow the science, and the science on the use of face masks says that they don't have a material impact outside of those settings which the Public Health England have set out. But also here we are following the international evidence too. The World Health Organization have themselves looked into this very recently and came to the conclusion that face masks should be saved for those in health and care who really need them. So it is not a risk-free option to have face masks, for everybody to wear face masks, because that means that it's harder to get hold of face masks for the people where the science says that they're needed. Professor.
Thank you, Secretary of State. Thank you, Ben. To your first point about closing borders, our scientists have been very clear from the outset that that would not work as a measure to prevent the ingress of coronavirus into the UK. Coronavirus is now in the UK and transmitting very widely. I understand the point you're making, and I see where you're coming from in terms of when we get this under control, doesn't that change the situation? But we won't go from a position of widespread community transmission amongst our own people to a position of zero transmission amongst our own people, which of course was the case back in December 2019. We will likely go back to low levels of transmission, and the virus will continue to be here in and around us in our communities, I suspect for a very long time, even if we can keep the levels right down. So from that perspective, I hope that adds a bit of sense to the context of the question around travel. Now, in terms of face masks and general wearing of them by the public, I do know that this is a very vexed and very emotive issue with citizens all round the world, frankly. And we have kept this under very careful and repetitive scientific review. Our expert advisory committee, NERVTAG, met again this week to consider all of these matters. And we do remain convinced that there just isn't the evidence base to support general mask-wearing use by the public. You've probably seen the paper that was released 4 days ago on BioRxiv by Paul Hunter's team from the University of East Anglia. They have been through all of that evidence again. We have looked at all of that evidence in that paper again, and it remains the case that we do not see, at this point, a persuasive argument for general mask wearing by the public. But I want to assure you personally, and of course, those who are listening in, that we will keep the science evidence under review. And we are going to be guided by the science, and if the science evidence changes, then we will change.
Thanks very much. Charlotte at Talk Radio.
Thank you, Mr. Hancock. Could I firstly ask how many frontline NHS workers have died from COVID-19? And secondly, could I ask, when a healthcare worker does pass away, has there been some form of investigatory process put in place so that we can learn lessons from what happened to them and make sure it doesn't happen again to their colleagues?
Yes, I think this is a question for you, Ruth.
Okay, thank you very much. We know that any death due to coronavirus is a tragic one. We also know that a death of one of our workers, one of our family, is, for me, heartbreaking. We do have numbers of people that have died, whether they're nurses, midwives, healthcare assistants, doctors. It would be inappropriate for me right now to go into listing them and numbering them, because we haven't got necessarily all of the position across England with all of the people's families giving us the permission to talk about them. But I recognise that we will and we'll want to make sure that we are learning any lessons to be learned, but it would be inappropriate for me to comment on any individual death that we've seen, whether that is one of our healthcare workers or not.
Thanks very much, Charlotte. Anna Mikhailova from The Telegraph.
A question for the Health Secretary. Economists are on average predicting that there's going to be a 14% drop in GDP in the second quarter of this year. And I understand some in government fear that it could be even worse. What would the impact of that be on the numbers of deaths that are not directly related to coronavirus?
This is a really important question, and one that I worry about a lot. The goal that I have as Health Secretary is to protect life. But you've got to make sure that you look at that in the widest context. Of course, protecting people from deaths directly due to coronavirus, and that's actually the subject of most of the discussions at these press conferences, and a huge amount of effort to make sure that the NHS capacity is there. The second type of mortality that we protect against is deaths that occur because the NHS is overrun. And I'm very pleased that thus far in this crisis, there is no point at which the NHS has been overrun, and every single person with coronavirus has been able to access the best possible care in the NHS because we've taken the action to expand the NHS, sourced the ventilators, and increased capacity with the Nightingale hospitals to make sure that there is always the capacity there. And that is obviously absolutely top priority, as we repeat at the start of each of these press conferences. The third type of impact is the impact due to delaying NHS activity because we're responding to coronavirus. Some of this you have to delay because, for instance, some treatments for cancer require you to take immunity down to very low levels, which is a dangerous thing to do when there's a very significant virus around. And then the fourth impact on mortality that we consider is the economic impact. Now, we do not yet have an established estimate of the impact of the huge problems in the economy that have been caused, and that impact on itself back onto the health of the nation. But it's a piece of work that I'm working on jointly with the Chancellor to make sure that when we make decisions about the big policy decisions, especially around social distancing, we take into account the entire impact on the health and well-being of everyone in the country, not just on the highly visible impact on the deaths from coronavirus, but right across the board, including indirectly through the economic impact of the crisis. So it's something that I, as a trained economist, I'm very alive to. I work very closely with Rishi on it, and it's something that will be at the heart of our judgments as we make those the decisions in the future. But what's clear is that right now it is too early to make those judgments, and so the position as of this weekend, and the most important message for everybody this weekend, is to stay at home, because that's what saves lives. Did that answer the question?
Well, can I just quickly follow up? You say that work is ongoing, and I understand if it is too early to tell what exactly the economic impact will be, but it's been reported today that there is existing government modelling of 150,000 deaths that could be unrelated to coronavirus, but because of all these other impacts that you've just listed, does that sound plausible to you as a ballpark?
No, I saw that figure in the Telegraph this morning, but it's wrong. It's not part of our internal analysis. When we do that analysis and are in a position that we've got confidence in it, then I'm sure we'll be able to answer the question more directly. But that 150,000 figure is not correct. Tom Newton-Dunn at The Sun.
Thank you very much, Health Secretary. Question to the Chief Nursing Officer, if I may first. When you're out and about, you're driving around, you see people flagrantly disregarding social distancing, mucking around in parks. There have been reports of hundreds of house parties being broken up by the police in Manchester. How does that make you feel personally after the very emotive words that you just said about your service and the colleagues you've lost? And a question to the Deputy CMO, if I might. Obviously, it's too early to start talking about relaxing the lockdown and restrictions because you don't have the data set. But when the time does come for that in weeks in advance, maybe, what are the sort of numeric targets you would consider happy for case loads in hospitals, admissions, overall fatality rates, whatever it might be? What's the level we have to get down to before you're happy to advise the government that it's now time to start thinking about relaxing them? Can you give the British people some sort of target they can look out for sometime in the future?
I'll ask, obviously, Ruth to answer the first and Professor Van-Tam to answer the second. But just before I do, I just want to correct something in the premise of the second question, which is that it's not that we don't yet have data. It's that the information that we do have so far shows that we're not there yet. It's because if you look at the curves, whilst they are flattening, they're not flattening far enough to be able to make any changes, and that's what SAGE will look at again next week. So just it's an important nuance in the way that the question was put. But I'll ask JVT to answer it if you're happy with that marginally reframed question. Ruth.
So, Tom, it's very, very frustrating. It's personally frustrating to see people clearly not doing social distancing and clearly coming out in large groups. I was only on the way here, going over Westminster Bridge, seeing a whole horde of cyclists coming together. It is enormously frustrating. And the reason that is frustrating is because there's also still occasions where my colleagues are getting abuse from their neighbours for driving off to work. So Sam, a nurse in a mental health organisation in east of England, had grief from her neighbours because she was travelling to work. Our nurses, our healthcare staff need to be able to get to work. It's right and proper they do. But my ask of everybody, please stay at home, save lives and protect my staff.
Thanks very much. Professor.
Thank you, Secretary of State. So Tom, thank you for the question. I completely understand that everyone wants a number or a figure or something that they can say, can I look out for this? Will that then begin to tell me that we're finally beating this for real, for good, in this wave, if you see what I mean? That advice, unfortunately, is complicated. It will come from SAGE, from the Scientific Advisory Group for Emergencies, and it will be based upon looking at the number of tests that are positive, that are coming through the system. It will be based upon the number of new hospital admissions with confirmed coronavirus. It will be based upon the number of people going to ICU and the number of deaths. All of those indicators will need to be taken into account to give us a proper, reliable picture that things are definitely on the downturn and that we feel confident that it is consistently now the case. And you've seen on the figures I've shown today with new cases, the figures are kind of bouncing around a bit, and that's entirely normal. That is random variation that you get with any biological phenomenon, any disease phenomenon involving humans. And much as I'm itching to give you one thing you can go on and say, this is the signal that we're looking for, then I just can't. It is just too soon, and it is a more complicated judgment than that, based on a number of indicators.
Thank you very much. Does that satisfy you, Tom?
Just a very, very quick follow-up. I completely accept Mr. Van-Tam's point. Can you, in which case, just define what we mean or what you mean by the peak? Because obviously there's weeks apart from hospital admissions and cases to fatalities. What exactly is the peak, and how do we know when the peak is passed?
Right. So in terms of the indicators I've given you, this whole concept is a bit like a hose pipe in your garden with a tap at one end, and when you turn that tap off, water still comes out the hose pipe for a few seconds before it dies down. And so it is with the indicators here. There are people being infected with coronavirus today. They will develop their symptoms at some point over the next 2 weeks. Regrettably, some of them will become ill enough to go into hospital, possibly about 7 days after the onset of their symptoms. And then not all of them will need intensive care, thankfully, only a very small proportion, but they won't all need intensive care the moment they're admitted to hospital. Some will perhaps take a few days before that happens, and that's a further delay. And then those that are unfortunately going to succumb to this disease don't succumb instantly. And again, that takes time for those deaths to show from infections that occurred maybe 2 weeks before that. And so from that perspective, we work all the time with these lag periods, and the peak of each of those indices will be different. And you do need to have a composite understanding of all of them, and to be thoroughly assured that this is now turning down for good in this wave, before you can signal to the government that it's time to think about what happens next on social distancing.
Okay, thanks, Tom. Hannah Allotman from BuzzFeed. Hello.
Hi. Mr. Hancock, how exactly are you going to get from 19,000 to 100,000 tests by the end of the month if 2 of the 3 mega labs that you set up won't be up and running for another couple of weeks? And what will you do if you don't? And a question for Jonathan Van-Tam. Doctors have told us that they're being asked to ration oxygen. What are you doing to ensure not just that the oxygen tanks are full, but hospitals have the capacity to deliver those supplies to patients at the rates that they need?
Thanks very much. I've set the clear goal of 100,000 tests a day by the end of the month, and I'm pleased that the number now is over 19,000 a day. I was setting out how we've got 4 mega labs coming on stream. The first 3 of those are already got going. It's the Cambridge one that will come on stream at the end of this month. And we also have all of the existing labs within Public Health England and the NHS and some other research institutes that we're using. As I say, this is a part of the national effort. And one of the things that's happened since I announced the goal for the nation as a whole and for the life sciences industry of 100,000 tests a day by the end of the month is we've had a huge number of offers of people who've come to us and said, well, we can turn this facility, which hasn't been a coronavirus testing facility, into a coronavirus testing facility. And facilities that we didn't know about, or equipment that we didn't know about, that they brought to the task. There's the other thing about the mega labs that we're opening is that many of them are staffed by volunteers, of volunteers who are super specialist in exactly what we need. And meeting many of them yesterday, it was incredibly inspiring to see what they're doing, because they know that this is vital for the national effort, and they've brought their skills to us to help everybody get through this, because testing is so important. So I've set that goal of 100,000. We're working 24/7 to hit it. Everybody can see the daily trajectory, which has almost doubled since I set it. And we've clearly got a lot of work to do to get to 100,000, but we are on track. The second question was to you, Professor.
Yes, thank you, Hannah. Oxygen. This disease is unlike anything I've seen in my almost 3 decades in medicine. It is really, really unusual in that the requirement for patients who are hospitalised to have oxygen is very high. And sorry to go back to the hosepipe analogy, but if everyone in a certain area turns on their sprinkler in the garden at the same time, the water pressure will go down for a while. And it is a logistic and engineering challenge to create all those thousands of extra intensive care beds that we have done with ventilators, and also secure the oxygen supply that goes behind them. Now, I do know that there has been absolutely enormous logistic work 24/7 behind the scenes to keep hospitals supplied with oxygen. But you're right, we have seen 1 or 2 reports of where something has gone slightly wrong with an oxygen supply, and that's partly about the stress on the whole engineering system of a hospital that is required to produce the oxygen demands for double the number of ventilators. And we have to learn as we go along, and our engineers have to adapt. And you are going to see these isolated incidents, and we'll learn from them. But oxygen supply, you're right to flag it, it's an unprecedented demand with this virus.
You might have been referring to the challenges that we had in Watford last weekend in the question. I don't know if there was more detail you wanted to ask about.
Specifically to our own story, we spoke to doctors across the country who said they were concerned by things that they were being told, such as that they may not be able to give oxygen to palliative care patients. And when we spoke to the BMA, they said they were really concerned by those reports, and it's something that the government should be taking seriously. Okay, so
the truth is that in all the challenges in oxygen supply that Professor Van-Tam has just set out, in all cases there has been available ventilated oxygen to be able to treat those who need it. And in fact, we have currently over 2,000 spare beds with ventilators. So we have spare capacity. And in fact, the spare capacity is currently going up faster than need. So the overall capacity is going up faster than need. So the spare capacity is increasing. So to anybody listening or watching, the message is very clear, which is there is enough capacity in the NHS to look after you, no matter if you catch it, how serious it gets. But it's very important that we don't allow the spread of the virus to accelerate, because we've got to keep that demand below the levels of supply, even though as we increase supply. On the point about whether an individual patient should be put onto a ventilator, that is a different question. It's not about the capacity, it's not about the availability of beds, it's about a clinical judgment for each and every person. And that should never be made on a blanket basis. It should always be made on the basis of advice of clinicians as to what is in the best interests of the patient. And it's something that came up, I think, last time Ruth and I were on this at this press conference. and we talked about it with respect to do not resuscitate notices, which are a standard part of any healthcare system. But there should be there is no link between the capacity of the NHS and the needs of an individual, because we have, thankfully, so far, in all circumstances, managed to keep the available capacity above the demand curve. And the reason we've been able to do that is because people are following the social distancing advice and staying at home. And if they weren't, that would be a much more of a challenge. So if anybody needs another motivation as to why you should stay at home and follow the social distancing rules, it's precisely because we don't want the concerns that you raised understandably in your question to become the reality across the NHS. I don't know whether you've got anything else to add, Ruth?
You're absolutely right, Secretary of State. Clinicians from all sorts of backgrounds are making those decisions all of the time. Even when patients are not in intensive care, people are needing oxygen, and clinicians are doing that day in, day out. They'll make sure that if a patient, a person at home, wherever they are, if they need to have oxygen, clinicians will be needing to do that, and they will. Thanks
very much. Dave West from the Health Service Journal. Hi, Dave.
Hi there. Firstly, for the Secretary of State, we've heard consistently from yourself and from government about the vital importance of staying at home to relieve pressure on the NHS and to save lives. We've also heard that if you do need to travel to work, you should, if humanly possible, keep going with social distancing measures and stay 2 metres apart from each other. And we've been told since your illness and the Prime Minister's illness that the government is conducting its business in a way so as to achieve this as far as humanly possible. Yet we've learned that a number of times in recent days you've continued to hold meetings yourself in your office with between 10 and 20 senior officials and their assistants, clearly not able to observe those rules of staying 2 metres apart and not working from home. Senior NHS officials dialing into those meetings have expressed senior concerns to us about the example that sets to their staff and the way they will behave, and concerns that they will in turn think that they need to be turning up to work and it's irresponsible not to. So are you going to stop holding those meetings in that way, or do you think that it's impossible for you to meet those rules? And then the question to Ruth or to Jonathan is a follow-up on Anna's about the wider health impact.
You're watching BBC News. We're going to leave this Downing Street press briefing. The 6 o'clock news is coming up next with Sophie Rayworth.